Hello everyone. Today we are going to talk about head lice. This is a topic that might make you feel a little itchy, but it is important for us to talk about because head lice happen to kids and adults. Unfortunately, they are fairly common in schools, so I want you to learn about what to do if you get them, and most importantly, how you can prevent getting them in the first place. This presentation was prepared to teach third grade students about head lice in conjunction with New Jersey Core Curriculum Content Standard 2.1 Wellness under Strand C, Diseases and Health Conditions. The content statement notes that by the end of fourth grade, students should learn about the use of disease prevention strategies in home, school, and community to promote personal health. Cumulative Progress Indicator 214C1 states that students should be able to explain how most diseases and health conditions are preventable. Head lice can be prevented, and that is something we are going to talk about today. At the conclusion of this presentation, you should be able to describe what a head louse is and what it looks like, briefly describe the life cycle of head lice, identify who can get head lice, identify the most common symptom of head lice, identify how to treat the hair of someone with lice, list at least 2 steps to treating the home of someone with lice, and identify at least one way to prevent lice. Let's start with the basics. What are head lice? Head lice, and if we are talking about only one, it's a louse. Lice is the plural form of louse. They're tiny insects that live on the human scalp, and sometimes in eyebrows and eyelashes. They don't live anywhere else on your body. They can't live on your dog or cat either. They only live on the human head. They're considered parasites, which means they live off their human host by biting and feeding off tiny amounts of their host's blood, a bit like mosquitoes. But unlike mosquitoes, lice do not have wings, so they cannot fly. They also cannot jump from one person to another. They can only crawl. And they're pretty fast crawlers. Every year, 6 to 12 million people get head lice, so they are a pretty common issue, especially for children. Head lice are about the size of a sesame seed. Sesame seeds are those little seeds that are sometimes on the tops of hamburger buns. Adult lice are brown, tan, or grayish-white in color. Newly hatched lice are called nymphs, and they're smaller than the adults, and they're lighter in color. This makes them very difficult to see. Lice have 6 clawed legs that help them hold on to the hair. What you might see on someone's head, even before you see adult lice, are lice eggs. They're called nits. Nits are tiny tan, brown, or gray specks that are firmly attached to the hair shaft. When you run your fingers along a hair, a nit feels like a tiny bump and is difficult to remove. White specks in someone's hair that move easily are probably dandruff. Nits do not move easily since the lice glue their nits to the hair shaft. Here's a diagram of the life cycle of head lice. They begin as eggs or nits and hatch into baby lice called nymphs after about 7 to 10 days. They feed and grow, and after about 10 days, they are considered adults. Adult females can lay up to 8 nits per day, but they usually lay about 5. The adults can live about 30 days on a human head. So if you figure about 5 eggs a day for about 30 days, just one adult female can lay up to 150 eggs in her lifetime. If all those eggs were to hatch, you would have a lot of bugs. You can see why it's so important to get rid of lice when you get them. The second picture you see here is an actual United States penny. In comparison to the penny, you can see just how tiny lice eggs, nymphs, and adults are. Anyone can get head lice. Having lice does not mean you are dirty or don't take care of yourself. In fact, lice actually seem to like clean hair because it's easier for them to hold on to and glue their eggs to a clean hair than a greasy, dirty hair. And yes, you could take a shower 3 times a day and still get head lice. Head lice need to stay nice and warm to survive, so they are happy with any warm head. That means they will live on a kid, a mom or dad, and even a grandma. Kids seem to get lice more frequently than adults, though, because kids are more likely to share personal things like clothes or hairbrushes, and kids are more likely to touch heads with each other when they play. We'll talk a little bit more about that later when we talk about preventing head lice. Lice are pretty gross, but they cannot make you sick. They also do not hurt, though they can irritate your scalp and make you feel very itchy. About the worst that can happen if you have lice is that you could get a skin infection on your head from too much scratching. That's why it's so important to get treated for lice as soon as you find out you have them. Certainly the most common sign of head lice is itching on the head, behind the ears, and at the back of the neck. The presence of the bugs themselves does not usually make you feel itchy, though. It's their bites. Lice bites cause a kind of allergic reaction that causes an itchy feeling, kind of like when mosquito bites make you feel itchy. If you have a very light case of lice, you might not feel itchy at all. In fact, you might not notice any symptoms for a week or more. It's possible that you might feel a slight tickling feeling of something moving on your head. You might have little red bumps on your head, on the back of your neck, and behind your ears from the bites. If you scratch at the bites, you might get sores. Lice can disrupt your sleep because they tend to be more active at night. And of course, if you have lice, you might have lice eggs visible in your hair. Remember that these eggs are called nits, and they're glued to the hair shaft. We talked about how lice like to be warm, and they also like to be where it's dark, where they can hide in your hair. Their favorite places to be are at the back of your neck and behind your ears. So those are probably the first places someone might notice lice eggs in your hair. Of course, if someone sees the actual bugs in your hair, that's the surest way to identify that you have them. Nits and lice will be found close to the scalp because that's where they are warmest and where they can bite. Remember that even if someone has long hair, nits and lice will still be found close to the scalp. They don't want to be down at the ends of your hair because they're not warm there. If the school nurse finds lice in your hair, don't panic. They are treatable. Remember, they're icky, but they can't make you sick. The nurse will call your mom or dad or even grandma and talk about how to get rid of them. She might send you home so your parents can get started on treating your hair, or you might be able to stay in school and finish out the day. It all depends on your school's lice policy and how many bugs the nurse finds in your hair. If your mom or dad finds lice in your hair, they will need to treat your hair and call the school nurse to let her know that you have them. That's so the nurse can check your friends and whoever you sit with on the bus to see if they have them too. It's really important to let the nurse know if you have lice so she can do her job. Most people start lice treatment by using over-the-counter products. These are treatments that you can buy in places like a grocery store or Walmart without a prescription from your doctor. It's important to remember that you need to follow the directions on the package very carefully in order for them to work. Most of these treatments kill the lice, and some also kill the lice eggs or nits too. It's good to kill the nits so they don't hatch and give you more lice. When you use something over the counter, you usually will need to use it again about a week later, just to be sure everything is dead. Prescription products are treatments that are prescribed by your doctor. You might need to use a prescription treatment if an over-the-counter treatment didn't work for you. Combing is very important in order to remove all the nits. Like we said, it's good to use a treatment that kills the nits, but you can never be sure they're all dead. That's why someone with lice will need to have another person very carefully comb through their hair and pick out the nits. Remember that we said they are glued fast to the hair shaft, so they need to be picked out by hand and by using a special comb with really fine teeth. It's called a nit comb. What you do not need to do if you get lice is cut your hair. Since lice like to be warm, any lice and nits on your head will be close to the scalp. You can treat your hair with products that will kill the lice, and you don't need to cut it. The most important thing to remember about treating for lice after you have treated your hair is to clean your bedding and the areas where you spend time at home. Your bedding and any clothes you have worn in the past couple of days need to be washed in hot water and dried in a hot dryer. That will kill any lice and nits. If you have things you really can't wash, such as stuffed animals on your bed, seal them in a plastic bag for 2 weeks. That will ensure that any lice or nits that have hatched are definitely dead when you open the bag. Little things that can't be washed, like headbands and hair ribbons, can just be sealed in a Ziploc bag and put in the freezer for a few days. We talked about lice needing to be warm to survive, so live lice can't survive off a human head for more than about 24 hours, and being in a freezer will definitely kill them. Hairbrushes, combs, barrettes, and any other hair items that can be washed should be soaked in hot water for 5 to 10 minutes, because lice and nits don't like to be really hot either, and that will kill them too. Finally, floors, furniture, and car seats should be vacuumed to make sure any stray lice and nits are removed. We talked about how lice cannot jump or fly, but they can crawl pretty fast, and they don't mind crawling from one warm head to another warm head. About the only way they can get on your head is if you touch heads with someone who has them, or if you share some sort of clothing item or hair accessory that has been recently used by someone who has lice. It's best to avoid head-to-head contact with others and sharing things that have touched another person's head. If you have long hair, you can sometimes avoid having your hair touch other people's by tying it back. Putting it in a bun really helps. Having lice can be pretty stressful for a lot of people. They might feel embarrassed or ashamed of having them, even though there is no reason to feel that way. It's really important to remember that, like we talked about, anyone can get lice, and it's important to make sure that you do not treat a classmate or friend who gets lice any differently just because the person has lice. A person with lice didn't ask to have them and probably doesn't want them any more than you do, so it's really important to not pick on someone just because they have lice. Lice are very common, especially among children. They can affect anyone, and even though they won't hurt you, they can be pretty annoying and inconvenient. If you find out you have them, don't panic, but have your hair treated as soon as possible, and make sure you wash your bedding well. Try to avoid head-to-head contact with others to keep from getting lice in the first place. And most important of all, be nice about lice. Be kind to yourself if you get them, and to others who get them. Lice happen, and they are nothing to be ashamed of.